Welcome to the Show Me of the Cranial Nerves. The first cranial nerve is the olfactory nerve. The olfactory nerve is an extension of the forebrain and continues in the anterior cranial fossa, forward in two bulbs, the olfactory bulbs. You can see these red lines here. These olfactory bulbs then send nerve fibres down through the cribriform plate of the cristagalli. And if we were to look in a sagittal section, the olfactory bulbs come around looking very much like this, and then they have 20 plus smaller branches that they go down through the cribriform plate and are of course sensitive to smells that are then detected in the nasal mucosa. And any odorous gas that is in the nasal mucosa gets picked up by the mucus. The odorous substances then dissolve, and then these are picked up by the bulb at the end here. We then have cranial nerve number 2, the optic nerve, and you can see here these red circles that are surrounding the optic canals. To transmit the optic nerve will continue forward into the eye, and the optic nerves join together to form the optic chiasm, and it's in the optic chiasm that some of the fibres decide to stay and some of the fibres decide to cross, and that this then continues and radiates backwards towards the visual cortex area. You can now see that just underneath the optic canals I've added in the markings of where the superior orbital fissure is, and this brings us on to our third cranial nerve, the oculomotor nerve. As its name suggests, motor and ocular, this is going to supply the extrinsic muscles of the eye. With the exception of two, it does not supply the superior oblique muscle, and it doesn't supply the lateral rectus. We next have the fourth cranial nerve, the trochlear nerve. The trochlear nerve also goes through the superior orbital fissure, and it supplies the superior oblique muscle. This is easy to remember because the superior oblique muscle goes up and through a little trochlear, a pulley system. And remember, the superior oblique muscle is responsible for turning the eye down and out. The fifth cranial nerve is the trigeminal nerve, and the trigeminal nerve is one of the largest cranial nerves, and it exits out through 3 different foramina. It has 3 main branches. Its first branch is going to be the ophthalmic nerve, and the ophthalmic nerve goes through the red line that we've already drawn on here, showing where the superior orbital fissure is. Its second branch, the maxillary nerve, goes through foramen rotundum, which you can see is the first blue marking, and its third branch, the mandibular branch, goes through the second blue marking, which is foramen ovale. Now this is quite a lot of things within this nerve, so we're going to have a look at it in a little bit more detail. So as we've already said, the trigeminal gives rise to 3 main branches. The first branch, the ophthalmic branch, is predominantly sensory, and the ophthalmic nerve passes through the superior orbital fissure and then gives rise to 3 further branches: the nasociliary nerve, the frontal nerve, and the lacrimal nerve. Now, it's also worth remembering that whilst the ophthalmic is predominantly sensory, it does carry some sympathetic and some parasympathetic fibres. So, tracking along through with the lacrimal gland, so hitchhiking their way all the way up from the facial nerve, is going to be some parasympathetic fibres to the lacrimal gland, and this is important in producing lacrimal fluid. I'm going to change colour to yellow to signify that coming up from the internal carotid artery in the nasociliary nerve, there will be some sympathetic fibres, and these will also be branches going through the long and short ciliary nerves that are going to supply the ciliary body. Now, the maxillary branch is carrying sensory fibres to give rise to a zygomatic, and it's through this zygomatic nerve that you actually have the hitchhiking of the fibres up to the lacrimal. We also have sensory branches that will be coming on down to supply infraorbital region and also the palatine. Now, there are more than one palatine branches. There is nasopalatine, greater and lesser palatine, but for the sake of this diagram I'm just going to write on there palatine branches. Now, the palatine branches also carry parasympathetic. I'm going to draw those as coming along through here and then hitchhiking their way down. And these have come from the pterygopalatine ganglia. Now, I'm going to choose a green colour to represent special sense, because also tracking along from the greater petrosal nerve going through the pterygopalatine ganglion, we also have taste fibres, and these work their way through the palatine nerves. So now we reach our third branch, the mandibular nerve. So our mandibular nerve is providing motor, which I've drawn in blue, to the muscles of mastication, but it also has sensory nerves that are going to come out, and these are the lingual, and the inferior alveolar nerve, so inferior alveolar is going to supply to the lower jaw, and also then arching back up and round the auriculotemporal. Now, to also add in a couple of other things, we have some parasympathetics coming along and travelling in the lingual nerve, but they're not alone, they're also accompanied by some special taste fibres from Cranial Nerve 7. These are from the chorda tympani nerves, and this is supplying taste to the anterior 2/3 of the tongue, the lingual nerve supplying general sensation to the anterior 2/3 of the tongue. We've now added the sixth cranial nerve, the abducens nerve. The abducens nerve is also travelling through the superior orbital fissure and goes to supply the lateral rectus eye muscle. We now have the facial nerve, cranial nerve 7. The facial nerve exits via the internal acoustic meatus, which is a little bit difficult to see on this diagram, but is about here. Now, it's probably worth explaining some of the branches of the facial nerve. Now, the facial nerve has two parts to it. The facial nerve proper exits via the stylomastoid foramen and travels on out to give rise to nerves that are going to supply the the muscles of facial expression. It supplies, so the facial nerve is giving rise to these branches. We have the temporal, the zygomatic, the buccal, the mandibular and the cervical, and these all go to supply the muscles of facial expression. The facial nerve also has components that are going to be carrying parasympathetic and special sense fibres. So what I've drawn out are the red parasympathetic fibres. These parasympathetic fibres coming up, going to supply, not very well written, the lacrimal gland, and down here the submandibular gland. Oh, run out of space. And the special fibres, these being taste fibres, going to the palatine taste fibres and taste to the anterior 2/3 of the tongue. Our next cranial nerve is the vestibular cochlear nerve, responsible for hearing and balance, and this nerve also travels through the internal acoustic meatus. Our ninth cranial nerve is the glossopharyngeal nerve, and this nerve travels through the internal jugular foramen. You can see the circle just lateral to the foramen magnum. The most important part of the glossopharyngeal nerve is that it's going to supply the posterior third of the tongue for both special sensation and general sensation. Next we have our vagus nerve, which goes down to supply structures within the larynx and within the thorax, and the vagus nerve also exits via the internal jugular foramen. It's just dropped slightly off screen, but our 11th cranial nerve is the accessory nerve, which is going to go and supply the trapezius muscle and sternocleidomastoid. And this brings us on finally to the hypoglossal nerve. Exits via the hypoglossal foramen, which is quite difficult to see. It's just with little dots just on the inside as soon as you start to get the foramen magnum. And the hypoglossal nerve is responsible for supplying motor fibres to the tongue. And that now brings us to the end of our Show Me on the cranial nerves, and you can now give yourself a big tick that you've ticked them off and worked your way through them. Well done.